What brings you in today? Could you describe your symptoms? Are there any side effects I should be aware of? I'd like to schedule a follow-up appointment. Are my test results in? Is this procedure really necessary? Welcome back to Speak Up, English Conversations for Real Life, the podcast that helps you boost your English speaking skills for everyday situations. I'm Ava.
And I'm Ethan. Are you ready to take your English to the next level? Today, we're diving into a topic that's crucial for everyone, going to the doctor.
That's right, Ethan. Whether you're a native speaker or learning English, medical appointments can be stressful. But don't worry. By the end of this episode, you'll feel confident discussing your health in English.
We'll cover 8 common situations you might encounter at the doctor's office, practice useful phrases, and even role-play some dialogues to help you prepare.
So, grab a notebook and get ready to boost your medical vocabulary and conversation skills. Let's get started.
Before we dive in, we'd love to hear from our listeners. Have you ever faced difficulties at the doctor's office because you didn't know how to explain your problem in English?
That's right. We want to know about your experiences. Maybe you couldn't describe your symptoms accurately, or you didn't understand the doctor's instructions.
These situations can be frustrating and even a bit scary. But remember, you're not alone. Many English learners face similar challenges.
We encourage you to share your stories with us. You can leave a comment on our website or send us a message through our social media channels.
Your experiences can help other listeners feel more comfortable and prepared for their own medical appointments.
And who knows? We might even address some of your specific concerns in a future episode.
Now, let's get started with some common phrases you'll hear at the doctor's office. What brings you in today? How long have you been experiencing these symptoms? On a scale of 1 to 10, how would you rate your pain? I'm going to prescribe some medication for you. Let's run some tests to rule out any serious conditions.
Great list, Ethan. Now, before we dive into specific situations, let's talk about some general symptoms you might need to describe to your doctor.
Excellent idea, Ava. Being able to accurately describe your symptoms is crucial for getting the right diagnosis and treatment.
Absolutely. Here's a list of common symptoms and how to describe them. Fever. I've been running a temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius since yesterday. Headache. I have a throbbing pain in my temples. Nausea. I feel sick to my stomach and might vomit. Fatigue. I've been feeling extremely tired and lacking energy. Dizziness. I feel lightheaded and unsteady on my feet. Cough. I have a dry, hacking cough that's worse at night. Sore throat. My throat feels scratchy and painful when I swallow. Shortness of breath. I'm having difficulty breathing, especially when I exert myself. Chest pain. I feel a sharp, stabbing pain in the center of my chest. Rash. I have red, itchy bumps on my arms and legs.
Great list, Ava. Remember, listeners, when describing your symptoms, try to be as specific as possible. Include details like
Excellent points, Ethan. Now, let's move on to our 8 situations you might encounter when visiting a doctor.
All right, I'll play the doctor, and you be the patient. Ava. Ready?
Ready?
Good morning. What brings you in today?
Good morning, doctor. I've been having a terrible headache for the past 3 days, and it's not going away with over-the-counter painkillers.
I see. Can you describe the pain? Is it sharp, dull, or throbbing?
It's a throbbing pain, mostly on the right side of my head. It gets worse when I look at bright lights or screens.
Excellent description. Notice how Ava used specific words to describe her symptoms? This helps the doctor understand the situation better.
Now, let's switch roles. I'll be the doctor this time.
Sounds good.
So, Mr. Johnson, based on your symptoms, I think it would be beneficial for you to see a dermatologist. Would you like me to give you a referral?
Yes, please. How do I go about making an appointment with a specialist?
I'll provide you with a referral letter. You can call the dermatology clinic directly to schedule an appointment. They'll likely ask for your insurance information as well.
Great example of how to ask for and receive a referral.
Let's move on to discussing medical history. This is crucial information for your doctor.
Absolutely. Here's a sample dialogue.
Do you have any pre-existing medical conditions or allergies I should be aware of?
Yes, I have type 2 diabetes, and I'm allergic to penicillin. I'm currently taking metformin for my diabetes.
Thank you for letting me know. Are there any major illnesses or surgeries in your family history?
My father had a heart attack at 60, and my mother has high blood pressure.
Excellent. Always be honest and thorough when discussing your medical history.
Now let's talk about understanding treatment options. This can be tricky, especially if medical terms are used.
Right. Here's an example.
Based on your symptoms, I believe you have acute sinusitis. We have 2 treatment options. We can try a course of antibiotics, or we can take a wait-and-see approach with some over-the-counter decongestants.
Could you explain the pros and cons of each option?
Certainly, antibiotics can clear up the infection faster, but they may have side effects like nausea or diarrhea. The wait-and-see approach is less aggressive and avoids unnecessary antibiotic use, but your symptoms might last longer.
I see. In that case, I'd like to try the wait-and-see approach first.
Great dialogue. Don't be afraid to ask for clarification if you don't understand something.
Another important skill is scheduling follow-up appointments. Let's demonstrate.
I'd like to see you again in 2 weeks to check your progress. How does that sound?
That works for me. Should I book the appointment now or call later?
You can schedule it with the receptionist on your way out. If something comes up and you need to reschedule, please give us at least 24 hours notice.
Understood. Thank you.
Remember, it's always good to confirm the date and time of your next appointment before leaving the office.
Now, let's cover how to discuss medication and potential side effects. I'm prescribing you an antibiotic. Take 1 pill twice a day with food for 7 days.
Are there any side effects I should be aware of?
Common side effects include nausea and diarrhea. If you experience severe abdominal pain or an allergic reaction like rash or difficulty breathing, stop taking the medication and contact us immediately.
Got it. Should I avoid any foods or drinks while on this medication?
Good question. Avoid alcohol and grapefruit juice, as they can interact with the antibiotic.
Always make sure you understand how to take your medication and what side effects to watch for.
Our next situation is asking for test results. This can be anxiety-inducing, but it's important to get clear information.
Hello, I'm calling about the blood tests I had last week. Are the results in?
Yes, they are. The doctor has reviewed them, and everything looks normal. Would you like us to mail you a copy?
Yes, please. But could you also tell me my cholesterol levels? I'm trying to lower them.
Of course. Your total cholesterol is 180 milligrams per deciliter, which is within the normal range. The doctor has noted that you should continue with your current diet and exercise plan.
That's great news. Thank you. Remember, you have the right to ask for explanations of your test results and what they mean for your health.
Our final situation is discussing preventive care. This is about staying healthy, not just treating illness.
Given your age and family history, I recommend we schedule a colonoscopy for you.
A colonoscopy? Is that really necessary?
It's a preventive measure. Colonoscopies can detect early signs of colorectal cancer, which is much more treatable when caught early. It's recommended for everyone over 50 or earlier if there's a family history.
I see. How often would I need to have this done?
If the results are normal, typically every 10 years. We can discuss the procedure in more detail and schedule it when you're ready. Preventive care is crucial for maintaining good health. Don't hesitate to ask about recommended screenings or vaccinations.
Wow, we've covered a lot of ground today. Let's recap some key phrases we've used. What brings you in today? Could you describe your symptoms? Could you explain the pros and cons? Are there any side effects I should be aware of? I'd like to schedule a follow-up appointment. Are my test results in? Is this procedure really necessary?
These phrases will help you navigate most situations at the doctor's office with confidence. Remember, it's always okay to ask for clarification if you don't understand something.
Absolutely. Your health is important, and clear communication is key. Practice these phrases and scenarios with a friend or a language partner to build your confidence.
That's all we have time for today. We hope this episode helps you feel more prepared for your next doctor's visit in English.
If you found this helpful, please don't forget to subscribe to our podcast, leave a review, and share it with your friends who are learning English. Every subscription and share helps us reach more learners like you.
Join us next week when we'll be tackling another real-life situation. Job interviews in English.
Until then, keep practicing, and remember, the more you speak up, the more confident you'll become. This is Ava.
And Ethan.
Wishing you health and fluency. Goodbye.
Wishing you health and fluency. Goodbye.